But check this out. So we have a chest x-ray shows patchy reticulonodular infiltrates in the mid and apical lung fields bilaterally. A picture of the lung biopsy is there. Which of the following cytokines have the greatest involvement in the pathogenesis of the lesion indicated below, where the arrow is? Now, I'm going to do this. I'll read the last couple lines like I just did. I won't look at the photo. I'm going to go to the top now. Read the first part of the scenario and see if the scenario has anything to give me, right? Then we could panic later together if necessary. A 38-year-old man comes to you because of fever, malaise, cough, SOB for 2 months. Okay. All right. Like not too much, but okay. He has had a 9-pound weight loss during the same period. Well, that just brought it up a notch because fever, malaise, cough, shortness of breath. But now you told me you lost 9 pounds in the 2 months. I'm a little concerned. Got to figure what it is. He works at a flour mill and does not smoke cigarettes. Stop. What happens now? What do you think is going on here? We have patchy reticulonodular infiltrate. I need the condition. Forget about the answer. I want the condition. See, a lot of you, I love that you know the info. I want to make you guys so strong that you know the condition and then you know what the answer is. You know why the other ones are wrong. So as you get on every Tuesday and Thursday with me, it's not just me watching, not watching me do questions. It won't help you. It's understanding that I could do one question with you guys and knock out 5, 6, 7 conditions. Times that by 40 questions, you're looking at hundreds in 1 hour, if you think about it. I mean, hundreds in that set that we do, right? So you said, okay, it's a 38-year-old man, comes to the physician, fever, malaise, cough. Someone said sarcoidosis. Okay, sarcoidosis sounds good because sarcoidosis has like the bilateral infiltrates, right? Because it looks like the big wing. But there's other things to sarcoidosis that this patient doesn't present with, okay? Which is fine because we're learning, right? We're learning. So now we say, okay, we have this thing here, guys. We have a person that has a 9-pound weight loss, and we have diffuse patchy reticulonodular infiltrates. Guys, here, flour mill. They're telling you where he's worked, okay? So now, some of you saying TB. Well, TB is what? Hemoptysis, travel history, fever, night sweats. So this exam, the writers, like I do questions for other things too, not for the actual USMLE, but we write the scenarios so close that most of the answers look good because they all share similar symptoms, okay? This one is hypersensitivity pneumonitis. You're like, wait, what? Well, okay. It's not TB. It's not sarcoidosis because it doesn't present that way. And you say, well, maybe I wasn't aware of that. That's okay. The QBank is meant to learn to teach you the QBank. It's not going to be guaranteed that what you see here is what you see exactly on the exam, hypersensitivity pneumonitis, but the length of the questions, and the test is very similar to UWorld and AMBOSS. It's been proven by many doctors coming out of the test who jump on to these sessions telling you about their experiences. They go, guys, NBME is nothing like the actual exam. It's the length of AMBOSS and UWorld. So look at the scenario here, hear the info, have a lot of answers, boom, hypersensitivity pneumonitis. You're like, this is messed up. Forget about this granuloma. You think you remember the granuloma. Maybe you do, maybe you don't. The view overlay here, the option that AMBOSS has, this is nice. It highlights these things here, right? But here's the problem. A lot of us might not be thinking about hypersensitivity pneumonitis. Of course not. But they play the game pretty good. The person is 9-pound weight loss, doesn't smoke cigarettes. This patchy reticulonodular infiltrates,